Carolyn Woodruff, co-chair of Giving Tuesday for Family Service of the Piedmont. We are pleased to have with us today Anna Kazanchyan, who is chairwoman of Peters Medical Research, our major sponsor for Giving Tuesday. Dr. Anna, welcome, and please tell us, why did Peters Medical Research decide to sponsor Giving Tuesday for Family Service of the Piedmont?
Hi, Carolyn, and it's my pleasure to be participating as a major sponsor for Giving Tuesday. Peters Medical Research's motto is partnering with our patients for the miracles of tomorrow. And we believe that family service provides essential services and essential help to our local community. And by conducting medical research and helping bring to patients locally drugs of the tomorrow that are safer and more effective, we are extending a helping hand to our community as well.
So you are also an emerging jewelry designer, which we're very excited. And for Giving Tuesday, you have been so gracious, in addition to Peters Medical Research being our major sponsor, to donating 3 of the most gorgeous necklaces I have ever seen in my life to die for our raffle items for Giving Tuesday. So now for our viewers, we're going to describe what's available from our emerging famous designer, Dr. Anna. So the first necklace is an aquamarine. So Dr. Anna, can you describe that aquamarine necklace for us?
Yes, absolutely, with pleasure. And thank you, Carolyn, once again. You're very kind. Designing and making jewelry is one of my favorite pastimes. It's enjoyable, and it's even more enjoyable to be donating these necklaces to wonderful causes such as Family Service Giving Tuesday fundraiser. So the first one is an aquamarine necklace that has 20 millimeter aquamarine beads, as well as cloisonné beads, as well as amethyst with vermeil clasp and accents. And it's something that one can wear with pretty much anything.
I love the necklace, and it retails for $5,200. So be sure when that's offered to give so you get in on that raffle. Now we have a second necklace that's going to be offered on Giving Tuesday. And the second necklace is green turquoise, which is really rare on what I see. Dr. Anna, can you describe the green turquoise necklace?
Oh, of course, with pleasure. It's one of my most favorite necklaces because it does make a beautiful statement. Again, it's large green turquoise beads together with large cloisonné beads and some vermeil accents and detail. And again, it's something that can be worn with a simple black dress and with some of the most elaborate dresses and gowns and still be able to make a statement.
And the retail price of this necklace is $3,600. And you can get in on this with your gift on Giving Tuesday to Family Service of the Piedmont. And believe it or not, we now have a third necklace that's going to be available for Giving Tuesday. And this necklace is say the word amazonite?
Amazonite.
Amazonite. I am not familiar with that stone, but the necklace is gorgeous. So tell us about the amazonite necklace.
It's a beautiful hue of blue, and it's actually a duo of necklaces that the lucky wearer can wear one at a time or both at the same time, depending on their mood of the day and the outfit that they're wearing. And again, it's much smaller amazonite beads than the previous 2 necklaces, with the smaller cloisonné beads, and again with vermeil detail, which is gold with sterling silver.
So this necklace, it retails for $4,800, and you can get in on this necklace for Giving Tuesday as well. Now, to show you some of the other famous places that our necklace, that Dr. Anna's necklaces have appeared, Dr. Anna, can you tell us where your necklaces have been?
Well, my necklaces have been worn by some of the famous personalities that many people might be familiar with. For example, Kim Kardashian has one of my necklaces, as does Juliana Margolis from ER, as do some of the operatic stars from the Metropolitan Opera. So, for example, Anna Netrebko, who's the famous Russian-Austrian soprano. She's also known as the diva of the Metropolitan Opera. Wears one of my necklaces, as does Anita Rachvelashvili, who's a very famous mezzo-soprano from the Republic of Georgia. She also has one of my necklaces, as does Sondra Radvanovsky, who is yet another very famous operatic star. I believe she's American-Canadian soprano.
So there are two necklaces that are not for offering for Giving Tuesday that we're showing just to show you some of the other work of Dr. Anna. And these two have pendants. Could you tell us about those necklaces, Dr. Anna?
Oh, absolutely. So one of them is chrysoprase, which is a type of chalcedony. It's got a very beautiful sort of greenish hue. Some of it almost looks like candy apples. And that one, the pendant has malachite and rubies and emeralds. And that's a statement necklace, if there's ever one.
Yeah.
And the, and the other one, the pendant, actually both the pendant and the beads are agate. The beads themselves are very intricately carved round beads made out of agate, and the pendant is sliced agate with silver and gold detail and diamonds.
Now you are wearing for this interview one of your necklaces. Would you tell us about this one?
Sure. This is chrysoprase. It's a kind of a chalcedony, and it's becoming increasingly rare. It's nowadays being mined only in a couple of mines around the world. So the prices have skyrocketed. It used to be in the semi-precious stone category, but it's being rocketed more and more into the precious stone category. Times
So
have changed.
we want to thank Dr. Anna Kazanchyan for being with us today, the chairwoman of Peters Medical Research. And Dr. Anna, any final words you'd like to say about Peters Medical Research, our major sponsor for Giving Tuesday?
So absolutely. First of all, happy and excited to be supporting Family Service of Piedmont, and would be happy to do so in the future. And I would encourage everyone to donate, 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 because it's going towards an exceptionally important cause. And also at Peters Medical Research, we will continue to partner with our local community to help them experience the benefits of some of the newer drugs that are in clinical development, but are not yet available to patients on a prescription basis. So we're looking forward to bringing miracles of tomorrow to our community and to the world at large through collaboration with local communities.
So we've been hearing in the news a lot about clinical trials. Just so that the viewing public has a clear understanding, are you doing with Peters Medical Research stage 3 clinical trials, stage 2 and 3, or all the stages?
So we're doing at the moment, we're doing stages 2, 3, and 4. Stage 2 or at phase 2, the medicines or the medical devices are being evaluated, their safety and efficacy is being evaluated on a small number of patients, usually in the tens to the hundreds. And then once it's proven to be both safe and effective, then it's being evaluated in a larger group of patients, sometimes in the hundreds to the thousands to the tens of thousands. So that's something that we do at Peters Medical Research as well. And then there is phase 4, which is when once the drug is or the medical device is available on a prescription basis, the drug company continues to evaluate its ongoing safety and efficacy. So we get involved in all of those stages, and we feel like we are providing significant value to the community and to the world at large by helping improve people's health and quality of life.
So Peters Medical Research is right here in Guilford County doing all of these amazing things. And Dr. Anna, just a bit, you are a medical doctor. Give us just a bit of your bio.
Of course, with pleasure. So yes, we're doing it at the heart of the county, as far as I'm concerned, in High Point, North Carolina. And in terms of my background, I'm originally from Armenia. I'm sure our listeners can hear hopefully only a slight accent at this point in time. I grew up in former Soviet Armenia, moved to the United States when I was 20 years old, and received my medical degree from Harvard Medical School. Also have worked at some of the marquee investment banks in the US, Goldman Sachs, Citi, Wells Fargo, and others, and worked as an executive at biopharma companies, and have always had drug development at the heart of me, because when you practice medicine, you can only benefit so many patients, but when you develop a drug, you can benefit tens of thousands, hundreds of thousands, and even millions of patients. So in addition to being the chairwoman of Peters Medical Research, I also am the founder and CEO of Saghmos Therapeutics, spelled Saghmos. It's actually biblical in origin, and it means psalm in Armenian. And we have a drug that we are planning to start a phase 3 clinical study on in 2021. And it is meant to prevent acute kidney failure due to contrast dyes that patients are given during either CT scans or heart procedures. And the reason that we chose that particular indication is because of my dad. He died when he was only 59 years young because his kidney shut down because of contrast dyes, and he was on dialysis for 5 years. So when I say that drugs can literally change a person's life or improve community's life, I know exactly what's at stake here, because me and my family were impacted by something rather tremendous and horrendous. So that's our mission, both at Saghmos Therapeutics as well as Peters Medical Research: make the world a much better place to live.
So with that, on Giving Tuesday for Family Service at the Piedmont, give for a chance to win one of the 3 memorable necklaces of Dr. Anna Kazanchyan. And with that, remember her story and the story of Peters Medical Research. Thank you, Dr. Anna, for being with us today, and we'll look forward to seeing everyone out there on Giving Tuesday.